Hello, welcome back to Dr. Hayatu's medical session. Today, we'll be discussing spontaneous vaginal delivery. Don't forget to subscribe to our channels and ring the notification bell to stay updated on our health content. Spontaneous vaginal delivery, or SVD, is the process of giving birth through the vaginal canal without the use of instruments, such as forceps or vacuum extraction, and without a cesarean section or significant medical intervention. It typically involves the natural onset of labor, which progresses without the need for inducing labor through medications or other methods. In SVD, the mother delivers the baby through the birth canal under the power of her own contractions. Let's discuss the stages of spontaneous vaginal delivery. First stage, labor. This includes the latent phase, where contractions start and gradually become more regular and stronger. The cervix begins to dilate and efface or thin out. Then the active phase, where contractions become more intense and frequent. The cervix dilates from about 4 centimeters to 10 centimeters. This phase typically involves more intense pain and requires more focus and support for the laboring mother. Second stage, delivery of the baby, begins once the cervix is fully dilated at 10 centimeters. It involves the mother pushing with contractions to help move the baby through the birth canal and ends with the birth of the baby. Third stage, delivery of the placenta. After the baby is born, contractions continue to help detach and expel the placenta from the uterus. This stage usually takes about 5 to 30 minutes. Fourth stage, recovery, the immediate postpartum period, typically the first 1 to 2 hours after delivery. The mother is monitored for any complications such as excessive bleeding. Bonding with the baby and initiation of breastfeeding often occur during this time. While spontaneous vaginal delivery is generally safe, there are some risks involved. Perineal tears. The perineum, which is the area between the vagina and anus, may tear as the baby passes through the birth canal. Postpartum hemorrhage. Excessive bleeding can occur after delivery. Shoulder dystocia. The baby's shoulder can get stuck after the head is delivered, posing risks to both the mother and baby. Uterine rupture. A rare but serious complication where the uterine wall tears during labor. Fetal distress. The baby may experience distress shown by abnormal heart rate patterns. Lastly, infections. There's a risk of infections to the mother or baby, though they are less common in spontaneous deliveries compared to assisted deliveries. Now let's talk about the advantages of spontaneous vaginal delivery. Shorter recovery time. Compared to cesarean sections, the recovery period for vaginal delivery is typically shorter, lower risk of surgical complications. This avoids the risks associated with major surgery, such as infections and reactions to anesthesia. Enhanced mother-baby bonding. Immediate skin-to-skin contact and earlier initiation of breastfeeding can enhance bonding. Faster postpartum recovery. Women who deliver vaginally often experience less postpartum pain and have shorter hospital stays. Fewer respiratory problems for the baby. Babies born vaginally are less likely to have respiratory issues because the process of passing through the birth canal helps clear the lungs of fluid. Lower risk of future pregnancy complications. Women who have cesarean sections face higher risks in subsequent pregnancies, such as placenta previa or accreta. Spontaneous vaginal delivery, while not without its risks, generally offers numerous benefits that contribute to the overall health and well-being of both mother and baby. If you found this information helpful, subscribe for more health-related content. Thanks for tuning in, and until next time, stay healthy.